Now we will start. So why correct sample size matters in clinical research? So do you have any of you had any experience where the journal has rejected your articles, or you had problems in calculating sample size, or you calculated sample size, or you did not calculate sample size, you did the study and you wanted to adjust the sample size to the study? So have anybody of you had your experience, sir, like that? So you can just come out, sir, if it is possible. You can also share your experience. We will go from there. You can just open your mic, sir, and you can also talk. Any of your experiences. So these are various articles telling about why sample size matters. This also you can look in your user time, sir. So what happens? So we are using smaller sample sizes. Like in your study, you are using only 10 patients in each treatment group. You are doing a study and you are having 2 treatment groups. So A and B. So you're using a 3 treatment groups. So you are taking only 10 patients in each treatment group. So what happens is, if you do the study in Tamil Nadu, it will give one result, like A is better than B. But if you do the study in people in Rajasthan, it may give like B is better than A. So whenever you use a small sample size, the problem is the findings can be different. So you cannot tell which drug is better. So which drug is good, you cannot tell. So only we need to have a larger sample size. But what is the problem with larger sample sizes? After a point, the results of the study will not vary. It will start having stagnant. It will start becoming stagnant. So you have to choose a sample size at this point. So the accuracy of the study does not prove beyond a sample size, like maybe 254, 354, like depending on your study. So you have to stop at that study. Then you should not go beyond that. So you're doing a study comparing the outcome of patients with stage 1 lung cancer. You're doing a lobectomy for one patient, and then you are doing a stereotactic body radiation therapy for another group of patients. So what is the sample size you have to choose? So common errors in proposal writing and data analysis. So before that, we'll see here. Can you tell us now, this is the study. Outcome of patients with stage 1 lung cancer lobectomy or stereotactic body radiation therapy. What are the parameters you have to take and give to the AI for calculating the sample size? So first, just you will take the parameters and then you will put it in AI and create the sample size forms. So can you open your mic, maybe a future madam, or even put in the chat box? What are the things needed for calculating the sample size? So what are the prerequisites for calculating the sample size? What are the prerequisites?
Maybe the treatment options like groups, how many treatment groups we have.
Yes, sir. Yes, sir. Good, sir. Superb, sir. So first is 2 groups. Yes, sir. So whenever 2 groups are there, it becomes a analytical study. As Sir pointed out, this is the main. You have to start with study design. So I have given also the tables for this, sir. So the elaborate, first we'll start with study design. You have to choose. So as Sir told, we have 2 groups. So it becomes an analytical study. So the sample size formula will vary for the 2 groups. Okay, sir. Next, sir. So this is the study, survival outcomes of patients with stage 1 lung cancer, lobectomy or stereotactic body radiation therapy. Yes, sir. Superb, sir. Study design and effect size. Yes, effect size. So effect size is like we are having the survival of patients. Out of the 100 patients, how many are going to survive with lobectomy and how many are going to survive with the stereotactic body radiation therapy? That is the effect size. So study design we are going to do is RCT. Yes, sir. Good, sir. A error a researcher is allowed to take. So what is the error the researcher is allowed to take? That is called as the precision. Accuracy, we were talking, no, sir. How much will be the results? What will be the accuracy of my results? Can put it as accuracy. How much accurate are my results? So has told most of these things. Thank you, Dr. Ashwati and Dr. Prakash. So I have given you everything here, sir. So you can use this. So whenever you are going to do a study, you have to fill all this. So whenever a client or like my colleague or any doctor asks me, I will tell them, sir, please fill this form and come back. Because otherwise we cannot have, at least they fill 2 or 3 things to be easy. So first we have to see the study details. We have to write the title of the study. Sir. So you're writing the title, then you have to fix the objectives, primary and secondary. So what was the study, sir? In our study, the primary objective was like survival. So like survival, or what is the mortality, or maybe, so what is the treatment success? So the treatment success is mostly based on the mortality. So we have to be very specific. So here it is mortality. After doing lobectomy, after 6 months, how many patients survive in lobectomy? After 6 months, how many patients survive in the stereotactic radiation therapy? So that is the primary objective. So what is there in the primary objective, sir? It should be very, very specific. We should know what is the outcome. So death or mortality. So mortality or death. Then death at what time? After 6 months or at 3 months or immediately after surgery. So death immediate post-operative or immediately after the procedure or at 6 months. So that is the primary objective. Then for every study, there will also be secondary objectives. So whenever we give the drugs, there will be side effects. So that will come the secondary objectives. Like what is the side effects, or what could be the other secondary objectives you can give. Like maybe like what is the hair loss, or maybe like what is the metastasis rate, or what is the like a bleeding complications, what is the rate of complications. So, or what is the duration of the hospital stay, or what is the number of times of recurrence. So always when you do a study, you have to fix the primary and secondary objectives. Then the study design matters. So whenever going to design a prevalence study, like what is the prevalence of cancer in India? What is the prevalence of a oral cancer? Like that, when you are doing, they are called descriptive studies. These studies have only single group. They are called as the one group studies or a single group study. For this, calculating sample size is very easy, sir. I'll show you. The other studies, what we mostly do is mainly RC, randomized control trial. There will be interventions. As previous speaker, Dr. Arun sir was telling, so we have to enroll our study in the clinical trial registry of India. If you are not enrolling, our study may not be valid. So any type of intervention, we have to enroll in the clinical trial registry of India. So what is the intervention? Like what you are observing is observational study. Two patients already they are taking some drugs which are already being used in the market, which are already approved by our the DGA or the Drug Controller General of India, DCGI. Then it is no problem. You can just observe case control or cohort if there are two groups. But if you are going to give a new drug or a new dose of a drug or a drug for a new specification, then it is an interventional study. Then in cancer studies, also diagnostic studies, like a new marker, you are going to find a new marker for any cancer that will become diagnostic studies. So number of groups based on the study design, you will get the number of groups. The outcome variable is prevalence or the mortality or outcome. Then here comes the next thing you should know is type of data. Like death rate means it is called as a proportion. Hemoglobin or something like numbers, it is called as a mean. So any numbers, it is a mean. For anything which is in percentage, it is a proportion. So then the effect size, this is the main thing solution, effect size. So first you'll choose how many groups a start with. At least if you, everything can be combined into this number of groups. Second one is what is the type of the data depending on your outcome variable. The next one is effect size. What is the minimum expected difference between the groups that is acceptable? So you can introduce a new drug, sir, but that drug, it may not give a great effect compared to the old drug. Like for paracetamol, I'm going to introduce a new drug like Velmurugan mol. But the Velmurugan mol is not having any significant benefits compared to paracetamol. Also, Velmurugan mol is more costly. Then what is the use? So you should fix a minimum difference. Like compared to paracetamol, the Velmurugan mol, it should reduce the temperature by 3 degrees Celsius or 2 degrees Celsius. or it should act for a duration of more than 6 hours, 7 hours, 8 hours. That is called a clinically significant difference. So when you are giving the sample size, which as a clinician you cannot tell this, the statistician will give you the wrong thing. So always remember, sir, in the studies you have to give the clinically significant sample size. Then the next thing is called type 1 error and type 2 error. So type 1 error usually that is called as the usually we'll take it as type 1 error. So by default you take it as around 5%. So type 1 error you take it as 5%. Then the power of the study by default mostly you take it as 80%. So if possible you can also take it as 90, but 80 is okay. That is accepted. So these are the two things you should know: type 1 error and type 2 error. Then the precision, how much should be the accuracy of your results? So this will also be usually be taken as 5%. What is the idea of precision is, like we are getting here, like after giving a cancer drug, the 90% of the patients are alive. After giving a cancer drug, after 5 years, 90% of the persons are alive. So what is the precision of 5% means? It can range between 85 to 95. Every time it will not be 95. Every time it will not be 85. It can range. 1 year, 85% of the patients can survive. 1 year, 95% of the patients can survive. So this is called as the precision. So what happens if you take a low sample size? It will go more variable, like 50% to 100%. At a time, only 50% of the patients are surviving, or another time, 100% of the patients are surviving. So the statistical test, it's okay if you are knowing, it's okay. Otherwise, it is not needed. Automatically, it will come depending on your study design. Then these are the things which we need the input from you always while calculating sample size. You have to tell the study population. Study population is like on which population you are doing a study. Study on bladder cancer. You should not tell like patients with bladder cancer. So, madam, you should always explain patients with cancer more than 18 years of age. Then you should correctly tell all the inclusion and exclusion criteria. Like you should tell the patient without any comorbidities. So always this has to be very, very clear. You have to rule out, you have to tell the exclusion criteria. Then totally, if you are telling, like totally in our hospital, we are having 500 bladder cancer patients. Out of this, how much sample I can take is from this approximate population. By using any sampling method, you can calculate your sample size. There are many sampling methods, but always I will tell you to prefer a sampling method called random sampling. That will give a better study results. There are many types, you need not know all the time. Just you can tell the sampling was done on a random basis or a simple random. Simple random is all the 500 patients, you are putting the name and taking like a lottery ticket. For this, now we are having the computer randomization tables or the simple table number book, like your log book, which you used in your 11th and 12th standard. So we have so many things. So you can just, I always prefer you to use something called as a random sampling. So next thing is dropout. All the patients will not come throughout the study. Some of the patients may go away. So always the dropout, it is better to fix the dropout as less than 10%. Then there is something called design effect. You need not worry about the design effect. Design effect comes into play when you are not doing simple random, when you are doing other type of sampling methods, cluster random. There are so many sampling methods. There is something called design effect. You need not worry so much about this. Then always have a reference article or a PDF ready. So when you are going to put it into the AI, we need this. The AI will calculate your sample size based on this reference study. And you can add any additional notes. So now if you are having all the details, we can do it in the AI for the sample size. Okay, sir. Now I will tell you, now we are going to first prepare a research proposal. Or first we can just have a research title. We are going to generate a research title. So I will give this, all of you are going to generate your research title. Now you are going to, all of you are going to prepare the research title. So you can just click it, sir. You are going to prepare the research title for your study. Okay. So whatever the study, anybody can tell, I will do it, or you can try it on your own also. can put the population specifically more than how many years. So anybody has any study on your mind, we can do it live now here. You can tell your inputs, I can tell them. Doctors, anybody can tell your what is the research you have in mind or what you have done already. You will create an app title for this research. This is called as a PICO statement: population, intervention, comparison, outcome, study design. So if you put this, everything should be there in your research title.
Okay, I can help you with the
Thank you,
study.
sir. Yes,
Yeah,
sir.
no problem. So population would be breast cancer patients, female breast cancer patients.
Yes, sir.
Uh,
So the age, any age, sir? No, specific.
uh, more than 20 years of age, 20 plus.
Okay, sir. What is the intervention, sir? Any
Intervention is MOM, MOM.
um,
Yeah.
comparison, sir? We are going to be
Co-
mom is like a
uh,
surgery.
no, it's a psychosocial intervention.
Okay, sir.
Yeah.
We're
And
going to
yeah,
compare it with normally what they are
yeah,
getting standard.
yeah, conventional psycho educational
Okay,
interventions.
sir. Yes, sir. Okay, sir. So what is the outcome we are expecting, sir?
Reduction in anxiety, depression.
Okay, sir. So this we can tell it in percentage, sir, like proportion. So it is called as a proportion. Like with this 10 percentage will be there. With normally there will be 20%.
Yeah.
So it is we are doing comparison. We are doing also a intervention. So it becomes a intervention
Yeah.
study. With no
Yes.
intervention, just analytical study. Then study design.
Yeah.
So we can do randomized. Also, we can do
Yeah.
non-randomized. Randomized means everybody has an equal chance. So study
Yeah.
setting like in a hospital or in a community or a tertiary care center.
It must
Medic,
be tertiary cancer center.
okay.
Yeah.
The place of the studies are like which place, any.
You can write in Kerala.
Okay.
Yeah.
You can just put no, sir, from January to December 2026.
Yeah. Yes.
So we are going to compare two things.
Yeah. Yeah.
So an interventional randomized control trial on female breast cancer patients more than 20 years of age, comparing MOM intervention with conventional psychoeducational intervention for proportion of reduction in anxiety and depression. So this is our study, sir. So our study will give everything. So when the journal reviewer reads this, they will be have a very good feeling of okay, he knows what is research, and they will approve it because you know everything clinically. You are the best person, but when you give to the journal, they may think they may not know your clinical acumen. Okay, sir. Thank you. So another sir, Dr. Satish Kumar sir, he also got it. I mean, interventional non-randomized trial on end-of-life care patients evaluating musical therapy with genetic dental counseling for reducing distress in the hospital in Chennai during 3 months. Yes, sir. We can be more specific. Very, very, very good, sir. Very good. Thank you, sir. So first time, sir. So this we can also do with AI, sir. I will also show you how to do the same thing with the AI also. So we are going. So all of you can go into first. You can try Chat GPT. So the same thing I will show you also in the AI how we can first generate the title. So Chat GPT is universal. So in Chat GPT recently it is giving something called free Chat GPT. It is giving a Chat GPT Go version free. So it is a free of cost for the next 1 year. So when you log into Chat GPT, it will show you. So you want to upgrade, you want to take the free version or not. So just you can type like, so always, sir, always you have to train the model. The first step you have to do in any AI is train the model. I am a researcher in clinical medicine, or like I'm a researcher with MCH surgical oncology degree. I want to do a study on, you can put uh, female breast cancer. So comparing MOM intervention versus conventional psycho educational intervention. Give me the full study title in PCOS format. Include as many elements as possible in title. So when we give, people are giving the feedback. So PCOS form. So you should know these terms. So when you tell like PCOS or something. So effectiveness of a mindfulness oriented motherhood based social intervention versus conventional psychoeducational counseling on psychosocial. See, sir, how many outcomes it is given. So out of these outcomes, which we want, we can take. Psychosocial distress, quality of life, treatment adherence, symptom burden, parallel group, randomized. I prefer this research. It will also generate short title, grant friendly title, consort aligned, abstract, sample size. So if I want to be more specific, then already I have even something like in our, instead of giving a prompt, we have this. So we can copy this. So we can copy this. And we can put, give me in the following model. And what is the link I gave, sir? The link was also created with the help of the AI. So give me in the following model. Then it will go and it will go to this website. It will search for everything and it will give you. So it will give everything. Among newly diagnosed adult women with breast cancer. Now with the same research title, now we are going to build a research proposal. We are going to build a research proposal. For research proposal, I'll give you a similar type of a format by which you can build a research proposal. So this is the research proposal generation, sir. So I'll give you this link. So you can all try this. You can click this, sir. You will go to a research proposal. How you are going to build a research proposal. So if you already will go to the research proposals. So this is how we are going to build a research proposal. We have the title, the background, objectives, literature, methodology, timeline, annexure, consent forms. So 1 or 2 times you can try building this. You can just type, you have to type everything, sir. Then you will get what is a research proposal, what we have to do. You can. Now we are going to use AI to prepare a research proposal. So now I'm going to use AI to prepare a research proposal. Sir, anybody can give another topic. If you want to try with another topic, or we can go with the same topic, sir. Building the research proposal. We will take this topic and we are going to build a research proposal for this topic. So just you are going to copy and paste in the chat GPT or Gemini or anything, build a research proposal in the format mentioned in the attached site for the topic. So as I told, we'll take the topic MOM versus conventional psychoeducational counseling. We're going. So now it is going to give you the full research proposal. So if you are interested, you can do it hands-on, sir. In this, you can do it hands-on. You can type it. You can write everything, and you can do. Or you can use AI to prepare this. Now the AI is going to prepare in a structured format. So it is giving the title, background, epidemiology. The problem with AI is the references. Since it hallucinates, the references may not be correct. So you always have to see the references alone. Check once by going to the references. So what is the gap in the literature? While psychosocial interventions have been studied in cancer care, there is limited evidence from countries like India in the context of MOM interventions. So we are getting the primary objective to compare the effect of MOM-based intervention versus conventional intervention on psychological distress among female patients with newly diagnosed breast cancer underlying multimodal oncology treatment over a follow-up period of 6 months. Here alone, it is missing the breast cancer patients aged to more than 20 years. So you can change. It is also giving a review of literature. But just you have to check the review of literature. Smith et al. For every review of literature alone, you have to go and you have to check it. Because the problem with AI is it can hallucinate. See, we are not able to find it. So it could be a hallucinated reference. So that is the problem with the AI. With the references alone, you have to check each references, each study. So you got one study. So the author names are wrong, but a study is there, but the author is wrong. So I tell you, you have to be careful in selecting the references. Otherwise, you will get everything: methodology, study design, study population, inclusion criteria, exclusion criteria, sampling, interventions, data analysis plan, timeline, how you are going to do the study, develop the protocol, ethics submission. The references alone, you always have to check. So each reference you have to check, and you may have to change the reference according to what you want. So this is how you are going to prepare a research proposal filter. So today, sir, madam, all of you can build your research proposal. You can do it manually, or you can also use AI. So I will also do the same thing with Gemini, and I show you. So we are going to take the same thing, and we are going to do the same research proposal with Gemini. We are going to Google Gemini. So first I will log on to Google Gemini. I am going to Google Gemini. So first, whatever model you are going, first you have to write like, I am a researcher. I am a surgical oncologist. I have 10 years experience. Now I'm going to build a project for the ICMR. So if you just give the prompts and you are training the model, then it will give according to your needs, it will give you the needed. So after this, we'll go into sample size calculation. We have built the research title, we have built the proposal. Next, we are going to sample size. So it is going to use conventional psychoeducational counseling on psychosocial distress measured by dash 21. Sir, it is right, sir, like a dash 21, like so Dr. Samim, sir.
No.
No, okay.
Yeah.
Okay, sir. So dash 21, it is
Yeah.
not right.
Yeah.
Like this, sir, EO, RTC, QLC.
Yeah. For
This
our
is some,
study, we are using some other questionnaires, but
some other.
your
Okay.
thesis occurs. It's also okay.
Okay.
Yeah.
So everything, this only I told, sir. So I always need a human intervention. We cannot copy
Yeah.
and
Yeah.
paste, but we have to check line.
Yes.
Thank you, sir. So this is the research proposal, sir. Now next we will go into the sample size calculation, the main part of our text. We are going to the sample size. So built. So we have got everything now. So the things you have to know: type 1 error, type 2 error, effect size, the margin of the error, then the study population. The fundamentals of sample size, population versus sample. So in most clinical studies, it is not possible to enroll all the entire population. Hence, we have to use a subset or a sample. So sample size, it is the number of individual participants. So sample size lies in the heart of the study design. So poorly chosen sample size, it undermines the reality or the reliability of your study. So what are the things you need to know the sample size? Calculate sample size, you need the primary endpoint. Then you need to know what is the minimally meaningful clinical difference, then variability in the outcome, then the alpha level or the significance level, the type 1 error, or how much error is allowed. Like you are doing a study for 100 times because everything is not 100% accurate. 5 times the drug can go wrong, or 4 times the drug can go wrong. So always we fix like if you are giving the paracetamol for 100 times, less than 5 times, that is 4 times, it may not cure the fever, but more than 95 times it should cure the fever. So the allowable error is less than 5. That is called as the type 1. So this is what is the type 1 error. So if you are giving a drug for 100 times, out of the 100 times, it should be able to get success in 95 times or more. It can get failure in maybe less than 5 times. So always you have to fix as type 1 error or the alpha level or the significance level. Next, type 2 error. It is called as the beta error. We need not worry about type 2 error. What we see is called power of the study. So whenever we are doing a study comparing the two drugs or two groups, we have always must mention type 1 and type 2 error. If you are having no idea statistically about this, just you can remember type 1 error, we can keep it as 5%. So always the number of times it can make error is less than 5. Type 2 error, the opposite of type 2 error is called the power of the study. So whatever calculators you use to calculate sample size, it will tell you about the power of the study. So the power of the study, you can keep it as 80%. You can even go up to 90, 100, but 90 and 100, it will make your sample size very large, 500 patients, 1000 patients, 1500 patients. So power of the study, if you keep it as 80%, it is okay. So these are the two things. If you are not from the statistical background, you can just get accustomed with this type 1 error 5%, power of 80%. All other things you can get it from your research article. So these are various articles in your free time. You can also check out these articles. These are my references. From all this, I have prepared the research calculators. Okay, so now we are going into the calculator. So you can just try this calculator. All these calculators, which I have shown for the research proposal builder, research title builder, all I have created with the help of the AI. So now we can try this calculator. I will just post you. Now we are going to calculate sample size for the studies. So I'll put in the chat box. So you can just click this here. If you click it, it will go. So these are various studies for testing. So for all this, you have to put some reference values. Now, you are going to see what is the level of hemoglobin in patients with maybe patients they are having suffering from lung cancer. What is the level of hemoglobin in patients suffering from lung cancer? Hemoglobin is a number. That is a number means mean. So for this, you have to take it from a research article. Hemoglobin level in lung cancer patients. So if you put some studies will come. You can take any study. So you can take any study. Just this is an example. Just you can take for the studies hemoglobin level it out to see what is the level of the hemoglobin. So in the study, it is not telling about the hemoglobin level. So median 8.73. So median is that. We have to get something called as the standard deviation value. So if you go and search in this, you can get something called standard deviation value. So here 11 it will be there. They will give it as median with standard deviation. And mean with standard deviation. So for example, we can take, so this is the mean value, this is the standard deviation value. So from any of the studies, you can take the standard deviation value. And then you can put it in the calculator. Then precision. So precision is how much accurate you have to take. So you can take precision as 5% generally. So alpha error is 5%. So it will give you required precision is 1%. So based on this, we can get the sample size. So now generally what we do is we can take two proportions. So we are going to see, this is the main thing we are going to do in cancer studies, comparing two proportions. So in the drug A, we are going to give in this drug A, there are around 30 patients died out of the 100 patients after giving a drug A. So 30%, 0.3. After giving drug B, 40 patients died out of the 100. So alpha is 5%, power of the study is 80%. So it will be a calculate. So sample size per to 354. So you can adjust like, no, I want my sample size to come around 100. So you can just adjust and you can see. But for this, you have to take some reference study. So with the reference study, what is the mortality in patients have giving lung cancer with the drug A, 20%. You have to take it from which study you can take it, and then you have to put the inputs. So this is how we can calculate the sample size. Mostly we are using the two proportions, comparing two proportions or paired means or two means. So for this, we have to understand this. But in case we are not able to understand this, so it is very difficult, sir, for me to understand. Then what we can do is just we can go into ChatGPT. In ChatGPT, first you have to find a reference article. So for this study, we are going to find a reference article from the Google. So we are having a reference article. So what we can do, this is my reference article. I do not want to know this number, sir. I don't like this. Just should give me. First, what you have to do, you have to just download the PDF. Or you can just take only this link, Control C. Then you are going into the ChatGPT. You are telling it, calculate sample size for this study based on the reference article. You are giving the reference article, you are doing the sample size. Then it will give calculate sample size for the study based on the reference article. In case you do not want any, sir, I cannot remember this alpha value, power value, sir, I don't like that. Just I am at a clean state of mind, I have to do. So calculate sample size, you have to copy and paste the single study. You can just upload also. You can also upload the PDF. You can also upload the PDF. Or if you're not able to upload, you can just put the link. It will calculate and it will give you the sample size. But why I told you all this, sir and madam, is because it may give, you should know to read. So what to change, what not to change. You should know what is type 1 error, type 2 error, or what is precision. So other than this, if they ask you questions in the ethical committee, you may not be able to answer. So the same thing, you can also try it in Google Gemini. So in Google Gemini, it has given till consent forms. Consent forms, patient information sheet. Now we are going to same as the same. It's also going to calculate a sample space. So till the Google Gemini is doing the work, we are going into ChatGPT and seeing the answers. So I will treat overall breast cancer, specific quality of life as your primary outcome. Sir, sir, Dr. Samim, sir, it is like any fact B total score it is there, sir, or can we substitute anything else? Like what is for your study, sir? We can tell it to give based on your study the sample size.
Can you repeat the question? It was not clear.
Yes, sir. Sir, the ChatGPT is giving the specific quality of life based on fact B total score as a primary outcome. So for your study, what was the primary outcome, sir? Like what score? Maybe we can substitute this and tell it.
I think it is quality of life, like PC. This is done by some other group, so I don't know which questionnaire they
Okay,
were
okay,
used.
sir. Okay, just
It
maybe.
is, yeah. You can write EORTC like QLQ C30.
Okay.
Yeah.
QLQ seated.
Yeah.
Okay. So we can tell it to use QLQ C30 instead. As the primary outcome. So what it has given is assuming 50 subjects per randomization group, the power is okay. 83% power is there. Okay. 80% if it is more than it is okay. Clinically difference 2.5. Okay. Between the two scales, if we get a difference of 2.5, it is okay. So it is giving the sample size is 50 per group. Sample size of 50 per group is okay. With this, we can do the studies. Now, these are the formulas. So alpha, type 1 error, beta, type 2 error. This is the power of the study. So this is the clinically meaningful difference. So it is calculated. So just we have to know, always in a sample size, it is for two groups, 50% in two groups. So it is totally 100 patients. Along with this, we can also tell it to add for dropout. So it will search for the reference article, which is having QLCQ30. It will find the articles with QLCQ30, and then you can quote it as the reference. Yes, QLCQ30, many people have done studies. So it is taking that, searching for standard deviation, and QLCQ30 study, it is going to substitute. So after this, we may take a mobility break for 5 minutes. So you all can bring your sample size or any your research question. We will try it hands-on now. So from 12:15 to 12:20, we can take a mobility break, sir. Just we can use a bathroom or breaks or a coffee. In the last 10 minutes, I will also show you the something about the data analysis. Assumptions for QLCQ30. So it is telling 10 points between the two scales, between the two groups. If 10 points are there, it is a clinically meaningful significance of depression or anxiety level of 10 points or something. The sample size, it has calculated as 90% per arm without allowing for dropout. So in case 10 people are dropping out during the time of the study, 121 participants. Research, but whenever you are giving this sample size calculation, it is better to calculate the title. Always have the title or build your research proposal, and then you can even upload your research proposal here. So you can upload your research proposal, or you can upload the research article, and then you can do it. So also I will show you about the analysis, sir. For analysis, I have given a file for you. You have received this, a dummy file for analysis I had given to you. Dummy data set. I think you all would have received in the chat box. So this is the dummy data set. So I'm just putting the dummy data set. So what is the dummy data set is? It has been created by the ChatGPT. Since we cannot give the real patient data to the AI, we have to be careful, sir. We cannot give the real patient data to the AI. So if you want to give the patient data to the AI also, you should change the names. No patient information should go to AI, sir. So this information should be non-identifiable information. So that is important, sir. So don't give any patient name or related details which can be coded. Like, okay, this is Munusami. The AI should not be able to identify. So always we have to remove the names or anything before giving to the AI. So this is an example of a dummy data sheet. It is a data sheet I prefer just for dummy. There is no real patients, just for showing to you. So what we do is, sir, while we are entering the data, instead of putting 52, what you do is you'll put as 52.0. Then when you do it manually in the statistical analysis tools, instead of male, sometimes you can write it as MALE, sometimes you leave it as M, sometimes you leave it as F. So it may create confusion for the statistical tools. So always the first thing we have to do while preparing the data before analysis, while entering the data is it should be clean. This is a clean. Then always you have to change it to numbers. Male means 1, female means 2. You have to give the next sheet. That is called as the next sheet you can write like, so male is a 1. This is called coding. Female is 2. If you're not doing with AI, you're going to give to some statistician. They should know this. Always you have to substitute everything with numbers. Smoking 1, no smoking 2. If you are not able to substitute with numbers, at least it should be uniform. Yes, no, yes, no. One time putting capital S and one time putting small s, it will confuse the results in normal statistical calculators. So always everything should be uniform. To maintain this uniformity only, instead of putting as male and female, we putting as yes is 1, no is 2. At that time, there will be uniformity. So always this data entry should be clean. If you are not having a clean data entry, it will confuse. So if you are going to give to any statistician, it will make your work very hell and they may charge you so much for a small work. At that places, the AI can also help to cleaning the data set. So this is the data set. Now see here, this is the patient age, BMI, systolic BP, diastolic BP, glucose, smoking. Is a patient on diabetes, on insulin, retinopathy is there or nephropathy is there. Now see with the AI, I'm just going to analyze this with the AI. So analyze this with the AI. Now we are going to just analyze this with AI. So analyze, always first you have to give two words you should know, sir. Analysis. Analyze, descriptive and analytical with tables. So descriptive means it will tell only about the age, groups. Analyze, analyze descriptive and analytical tables. So first we will tell the analyze descriptive. Descriptive, we can just tell. So it is reading. So till it does the analysis, we may have a short break, sir, mobility break for 5 minutes, and we can come back. Yes, we can have a short break for 5 minutes. Please analysis and we'll come back, sir. And join back at 12:23. We can join back at 12:23. Just for 5 minutes, we can have a short break. We can come back and I will show the analysis part. So, okay, doctors. Okay, so, okay, madam. Welcome back. I think you are able to hear me. See, first, we want two types of analysis: descriptive analysis, inferential analysis. So, I uploaded this data sheet. After uploading the data set, it is reading the file. So, the telling about the what is the mean age of the patient, what is the duration of the cancer, duration of the diabetes in the patient, how many have cancer, how many have died, how many have not died. That is called descriptive statistics. So, totally, I have 30 patients and 14 types of variables. So this is called as the descriptive statistics. Age, BMI, like what is the HbA1c, systolic BP, diastolic BP. Always it will give the mean value with the variability. Value with the variability. Then after the descriptive statistics, what you can do is next. So first we did descriptive, next comparison. That is called inferential statistics. So what you are going to do, like the logistic regression or regression, what we do in cancer or oncology is survival analysis, regression analysis. For all these are called as the inferential statistics. I will also show an example with the inferential statistics, how it can be done survival analysis. So if you are having any problem, it will tell. So you can tell it to correct. Correct the file and so similar to this, ChatGPT, the same with Google Gemini. For analysis itself, there is a separate website that is called as the Julius AI. I request all of you to go and log into Julius AI. So the Julius AI link I will give you. This is a AI specifically for analysis. The specifically tool for analysis is Julius AI. This is the AI tool which is specific for analysis, the Julius AI. So you can just click on this link, it will go to the Julius AI. So I'll also give it in the chat box, the Julius AI. This is the Julius AI. So if you go, you can log in with your Google account. If you go, you can log in with your Google account. If you log into your Google account, you can see just I will log out again and I will log in. So when you go into Julius AI, this will be the opening page. Then you can go for login. You can click login. After login, it will tell you continue with Google. So only I wanted all of you to have a Google account or Gmail account. After you click continue with Google, it will go. To the Julius AI. So the same data I'm going to compare with Julius AI. Upload file. I'm uploading. So whatever command you want to give, if you give it, it will run it and give you. So it is reading. So I'm giving the command. So give descriptive and inferential statistics. Analyze and give descriptive and inferential. Descriptive means just describing. Inferential is like comparing. Comparing a Maruti car with a Tata car. Compared to Maruti car, Tata car is strong. Or compared to Tata car, Maruti car is having a lot of mileage. That is the inferential statistics. So it is more statistically significant than this. For this, so just giving so descriptive, inferential. Just you should know the two words: descriptive statistics, inferential statistics. For the same and do the analysis. So this analysis. We have done the same analysis in ChatGPT also. We also want some charts. You can ask any question on your data, whether this cancer drug is better than that, or what is the impact of the physical activity on glucose control. It will read the data and give the answer for your data. So you give Julius AI, that is given. It is giving like a p-value. Now you do not know the meaning. Sir, what is the meaning of this p-value? It got the graph and everything. So then it will also give in this data set, patients who are more physically active tend to have better glucose control and the association is statistically significant even with only 10 people. So this is how we can get the results as well as the images. But the Julius AI, it is only free for a basic analysis. You may need to have subscription for doing a lot of analysis. For ChatGPT, you can have something called ChatGPT Go for ChatGPT. Then for ChatGPT, there is another trick called GPTs. If you go into the site, there is something called GPTs. In this GPTs, you can explore. There is somebody has already created many GPTs. You can just like data analysis. If you, if you put it in the search box, it will explore what are the already trained models. These models have already been trained and kept. You need not do training anything. You can see data analysis and report AI. You can start a chat. So you can also make use of this GPTs. So analyze the data and tell me what you see. Now I'm going to give an analysis of the data. So I'm going to do a sample study or a cancer data. So I have a cancer data. So cancer study data created by the AI. I'm going to insert it. Now we can get a result similar to that what you get in your cancer studies. So analyzing. So data treatment with osimertinib on the stage of the cancer patients. Patient died or not. Now it is going to give me the Kaplan-Meier survival analysis, Cox regression, and the hazard ratios, which you are going to see in our most of the articles what you have seen. So now we will tell it to give the Kaplan-Meier survival curves. So when you go into ChatGPT, on the left side there is something called GPTs. These GPTs, they have many pre-trained models. One of the pre-trained models is like data analysis. If you go into any pre-trained model, it will make your analysis very easy. If anybody has some data, you can put, but always the data, it should not have any patient name. We should remove the patient name and select the identifier information before giving to the AI. So this is with ChatGPT. Another specific AI tool is called Julius AI. So this is the Julius AI. Julius AI. So what are the analysis I have done in Julius AI? I'll show you. This is how the Julius AI has given. This is the survival analysis Kaplan made. Just you are putting input, it is given. This is what you see in your journals. It is very simple. You just upload your file and you are giving the command. Just you can upload and you are given. This is the option. This is the uploading the file. You can upload and you can ask whatever your questions you want. Similar to ChatGPT. You are going to upload and you are going to ask the questions. So, any doubts also you can just put in the chat box or you can open the mic and talk. In the meantime, it is analyzing. We are just on test, madam. So the tools I have introduced to you, specific tool is Julius AI. Do try this tool, Julius AI. It is very easy. Next is with ChatGPT. You can use something called GPTs. It will be in the left side, and you can use, or you can use it in the normal chat itself. The same thing you can also try it with the Google Gemini. You can also try it with the Google Gemini upload file option. You can just upload any dummy data. So the two things, descriptive statistics and inferential statistics for the above data. Then just put it will give you. Then if you have any specific questions related to the data, you can ask. It will analyze and give you. If you do not know anything, just you can put descriptive and inferential. ChatGPT, it gave the Kaplan-Meier curve. So in the 3 stages of cancer, how is the survival? What is the probability of the survival? 100% probability at the starting, 100% people are there. Then all the 100% or nearly 95% died in stage 1B, stage 2, stage 3A. How is the death? You can download also. This is with ChatGPT. You can use GPTs, the left. Google Gemini also, you can get the same results. You can also try these calculators I have given in the PDF sent with you in the mail. You can try this. So today, try out this Julius AI. Try out this Julius. So garbage in, garbage out. If you give garbage in, you give the garbage out. So always it is better to give the proper values, then only you can get. Then unrealistic assumptions. Thinking that mostly 100% of the patients may survive. So for all this, AI can make mistakes. So you are the person to make the realistic assumptions. So always know the difference between descriptive statistics and inferential statistics. You can also use a AI for cleaning the data sets, for cleaning the outliers. Just you can put the question. So I'm a researcher with 20 years experience. Check there whether the data set is correct or not. So protocol, always have the protocol. Then you go to the sample size, then the data sheet analysis. Then only you can write the manuscripts. So if you have any ideas, you can tell. We can wind up the session otherwise. Thank you, madam. For the next speaker.